On this Saturday night, the devastating peak of the third wave. ICU admissions hit a record high in Ontario, with more patients on ventilators.
People think they're invincible and they can't get it, but I'm sorry to say you can.
As the virus fixates on younger people. The rollout of the Johnson & Johnson vaccine on hold in Canada. The worsening wave in India.
And these 2 weeks are going to be a hell for us.
American aid is on the way to this desperate nation. And the long run.
I'm going to attempt to run 30 marathons in 30 days.
A BC woman's marathon mission.
Global National with Robin Gill.
Good evening and thank you for joining us. For doctors in Canada's biggest province, their biggest fears have come true. Ontario has now set a new record for the number of patients with COVID-19 in intensive care. 900 people are in the ICU and many of them are on ventilators. But just as worrisome is the new face of this new wave, a younger demographic. Mike Le Couteur has our top story tonight.
If I can get it, anyone can get it. People think they're invincible and they can't get it, but I'm sorry to say you can.
A dire warning from a 30-year-old retail worker hospitalized with COVID-19. In many ways, Danica Petitpas is the face of Canada's third wave. The Dartmouth, Nova Scotia woman has spent nearly a week in hospital so far.
It was scary because I didn't know, was I gonna come home? Was I ever going to see my husband again? Were I going to see my animals again? I didn't know.
Remarkably, her husband is doing fine. Petitpas doesn't know where she contracted the virus and is warning others to take COVID-19 seriously. It comes as Nova Scotia reported a record 148 new cases Saturday. That's the highest number of daily cases since the pandemic began. But it's not unexpected. The province is dealing with a lab backlog. The COVID-19 case counts are also high in Alberta, as that province continues to have the largest average number of confirmed cases per 100,000 people. In Ontario, intensive care units have hit a new milestone with 900 patients in critical care, putting an even greater strain on the provincial healthcare system.
What that's doing is essentially cannibalizing most other things in hospitals at the moment. Our backlog of surgeries is about 250,000 cases compared to where we were this time last year.
Doctors on the front lines are feeling the stress, but there is also a sense of optimism.
If we look at the whole picture, we are already starting to see a plateauing of the hospitalizations, the community numbers, and even the ICU numbers. So we're probably close to the crest, and then things will start to get better in the next couple of weeks.
But clearly, some people don't think we should wait that long. An anti-lockdown protest in Montreal forced the city's largest vaccination center to close Saturday.
I think it's not fair what they're doing. Summer's coming back. We want our freedom back. We need our summer.
Politicians and health officials say the sooner people follow the rules, the sooner things can go back to normal. And demonstrations like this one may only prolong the lockdowns. Mike Le Couteur, Global News, Ottawa.
Canada's vaccination campaign is facing another setback. Health Canada is putting a hold on the first shipment of the Johnson & Johnson vaccine. 300,000 doses of the one-shot vaccine arrived in the country on Wednesday, but the shipment came from the Baltimore, Maryland plant that mixed ingredients, ruining 15 million doses. Health Canada tells Global News it is completing an assessment before releasing the vaccines for distribution. The COVID-19 crisis in Canada's long-term care homes has taken the lives of more than 15,000 Canadians. Now, an independent report looking into the sector in Ontario shows chronic underfunding and severe staffing shortages contributed to the deaths of the most vulnerable during the first wave of the pandemic. And while that was happening, medical experts warned that infection prevention programs needed an overhaul before the second wave hit. As Emanuela Campanella reports, those warnings were not heeded.
As the pandemic started to claim its first victims, it was clear long-term care residents were the most vulnerable. Then, COVID-19 became a shockwave that cracked wide all the fractures in our long-term care home system, including the lack of infection prevention and control measures, known as IPAC, which are essential for managing outbreaks. And while Ontario had months to prepare after the catastrophic first wave, those on the front line say care homes were ill-equipped for the second.
Why was this sector so neglected, and why did nobody act on what was learned in the first wave to prevent it from happening in the second wave?
Global News obtained documents that show IPAC leaders across Toronto were calling for stronger infection prevention and control measures.
Everyone recognized just how bad things were and how much was needed.
In the spring, the team of physicians was asking for a dedicated hospital lead to train nursing home staff on how to prevent transmission and the proper use of personal protective equipment.
You know, people who work in long-term care are not trained to do infection prevention and control the same way as people who work in hospitals.
An internal document obtained through Freedom of Information reveals the Ontario government knew IPAC was significantly under-resourced to protect basic needs of residents.
It wasn't until the late fall, when the second wave was in full force, that the provincial government gave care homes details of their IPAC plan. They would get some support from hospitals, but they were still left to run their own program.
The Ministry of Long-Term Care says it identified at-risk homes and also provided IPAC support through training modules and staffing from the Red Cross. Still, health experts say IPAC needs to be prioritized for the long term.
You're trying to put out fires as opposed to trying to prevent the fires. What we really need to do is to start to try to get ahead of it. Instead of managing a crisis, start working on preventing the next crisis.
Emanuela Campanella, Global News, Toronto.
To learn more about our investigation into how long-term care homes were ill-prepared for the second wave, watch The New Reality tonight at 7 here on Global. The European Union wants to salvage its tourism industry by implementing vaccine passports. These digital green certificates would provide proof of a vaccine against COVID-19, recovery from the illness, or a negative test result. The EU still has to figure out a uniform plan among its own member states. But if international travel is going to happen, the Canadian government will have to consider its own program. Here's our chief political correspondent, David Akin.
To cross an international border, you will almost certainly need a passport. But now, some countries are thinking of also asking travelers to produce a COVID-19 vaccination certificate, a vaccine passport. This would be recognized at borders as proof that an individual has been vaccinated. But while some other jurisdictions, notably the European Union and the United States, are moving quickly to develop vaccination certificate systems, Canada has only just started work on the concept.
I can assure you that our decisions will be based on science, and the fact that those decisions are ongoing and those discussions are ongoing right now means that we will be aligned with our partners around the world.
One problem, the science is not yet clear that those who are vaccinated will no longer be contagious. So if you could still pass on the virus even after getting vaccinated, that might make a vaccine passport less useful.
The data is looking pretty good towards the direction that vaccines probably do protect against a reduction in transmission. The extent to which they do that is an evolving scientific study.
Also, the science is still unsettled as to how long each vaccine works. Boosters might be required at different intervals for different vaccines, and that issue goes to the difficulty of how frequently someone would need a vaccine passport renewed. And then there's a uniquely Canadian problem. Provincial governments are the ones who hold detailed vaccination data, so Ottawa would need to negotiate access to include it on a federal travel document.
Government officials say there's also some privacy and ethical concerns with vaccine passports. Still, industry sources say there are solutions to all of these problems, and they'd like to see Ottawa and the provinces get to work on them now for the day, whenever it may come, that Canadians are ready to welcome back foreign tourists and even pack their bags themselves. David Akin, Global News, Ottawa.
The COVID-19 crisis in India is getting even more dire, and officials say it will continue to peak over the next 2 weeks. For the first time, new cases of the virus have topped 400,000. In just the last 24 hours, more than 3,500 people have died from the virus, pushing India's pandemic death toll to close to 212,000. The situation has prompted the U.S. to join a long list of countries imposing restrictions on travel from India, a move that will close a loophole for Canadians hoping to travel home through the U.S., and a warning that some of our viewers may find images in this story disturbing.
Day after day, agonizing scenes from India as the country struggles to get a grip on its COVID-19 crisis. The world is taking note. Fearful infections will spread beyond India's borders. America has joined Canada and other countries in announcing a new travel ban on non-U.S. citizens coming from India. Already one of the COVID-19 variants that originated in India has been discovered in Michigan.
There's going to be a travel restriction starting on Tuesday on the advice of the Centers for Disease Control. Our COVID-19 experts, medical experts, our national security advisors.
The U.S. State Department has also issued a travel advisory against going to India, but some people are still traveling there reluctantly.
I have to travel due to some family emergency, but due to the pandemic, I'm a little scary.
As India's healthcare centers reach their breaking point, the U.S. is sending aid. 2 of these military planes left Travis Air Force Base in California, carrying over $100 million in medical supplies, including oxygen, N95 masks, and rapid COVID-19 tests.
The right thing I see right now is thousands and thousands of people that need help.
No more beds.
The aid can't arrive quickly enough as doctors have no choice but to turn away the critically ill.
I get maybe around 50 calls every day. Somebody asking for beds, somebody asking for cylinders, somebody asking for drugs. We don't have anything.
Adding to the misery, a fire in a COVID-19 hospital ward in western India early Saturday that left at least 18 people dead.
This pandemic is the worst we have ever seen till now. And these 2 weeks are going to be a hell for us.
India has opened mass vaccination sites to all adults, but some centers have already run out of shots. As the death toll mounts, this gravedigger says they have run out of room for all of the bodies. Crematoriums are also running out of wood, so trees in city parks are being cut down, and bodies are burned wherever there is space. Jennifer Johnson, Global News, Washington.
There could be a legal fight over Australia's unprecedented travel ban that prevents its own residents from returning from India. As of Monday, it will be temporarily illegal for Australians who've been in India to enter their own country. Those who defy the order could face fines of up to $63,000, 5 years in jail, or both. Direct flights from India have already been halted, but the concern is over Australians traveling via a third country.
We've also got to protect Australians. And the situation in India is dire and very serious. And we need to take and act on the medical advice that is provided to us. That's what we did at the start of the pandemic. That's what we're doing right through this pandemic.
The move leaves more than 9,000 Australians stranded in India. The UK sanctioned a rave as part of a pilot project to see how many more venues can be reopened. About 3,000 people packed a warehouse for the 2-day event. There was no social distancing and masks were not required, but they had to test negative for COVID-19 within 24 hours of arriving. Those who attended will now be monitored for symptoms, and researchers will assess the risks of transmission. The British government plans to lift its lockdown entirely in June. Coming up, the Legal Mind launching another review into the Canadian military. For months, Global News has reported on the allegations of sexual misconduct in the military. Defense Minister Harjit Sajjan has now tapped retired Supreme Court Justice Louise Arbour to lead an independent review. This is yet another review looking into the Canadian Armed Forces. Our Ottawa Bureau Chief Mercedes Stevenson spoke with Sajjan on this week's edition of the West Block. Mercedes.
Robin, this isn't the first time the federal government is admitting it has failed survivors of military sexual misconduct. Just 6 years ago, former Supreme Court Justice Marie Deschamps delivered her landmark report on this very same issue. She laid out a clear path for the government to address a problem that has plagued the Canadian Forces for decades. But several of the report's key recommendations were ignored. Now both Prime Minister Justin Trudeau and Defense Minister Harjit Sajjan are apologizing to survivors of sexual misconduct.
We're sorry.
We're sorry that a process that has failed you, that did not give you the comfort that you could come forward and without the fear of reprisal. Something that we are absolutely committed to fixing, and we will.
Survivors tell me some are skeptical, but they are relieved to see the government taking action. There are still questions, though, about whether more should have been done in 2018. That's when the military ombudsman at the time told Defense Minister Sajjan of an allegation of inappropriate behavior by former Chief of the Defense Staff, General Jonathan Vance. Vance has denied all allegations he acted inappropriately. The Prime Minister has said no one in his office knew the complaint was a, quote, Me Too complaint. But Global News has seen documents showing bureaucrats were told the allegation involved sexual harassment. And so I pushed the minister on what exactly he knew about that complaint. Were you aware that it was sexual in nature or had to do with conduct around women?
Well, to be honest, that's something that, as I stated, I didn't have much details on that. I wanted to. My priority was to making sure that the former ombudsman was able to then take it immediately and speak to the Privy Council office about this, so that the appropriate action could be taken.
Also on the show this week, I'll speak with Health Minister Patty Hajdu on whether her government is doing enough to protect Canadians from a crippling third wave of COVID-19. Robin?
All right, Mercedes Stevenson in Ottawa. Thanks, Mercedes. You can see the interviews with Defense Minister Harjit Sajjan and Health Minister Patty Hajdu tomorrow on the West Block, right here on Global. Still ahead, a bombing leaves Afghanistan in anguish. At least 27 people were killed and more than 100 others injured in a suicide bombing in eastern Afghanistan. High school students are among the casualties. They were staying at a guest house, preparing to take university entrance exams, when a truck packed with explosives was detonated outside the home. The seriously wounded were taken to hospitals in the country's capital, Kabul. No group has claimed responsibility yet, but the Afghan government accuses the Taliban of carrying out the attack. Afghanistan is bracing for more violence as the U.S. begins withdrawing its troops from the country. About 3,500 American soldiers are still there. President Joe Biden says it is time to put an end to what has become known as the forever war. Today was the day all foreign soldiers were to leave the country under an agreement between the Taliban and the former Trump administration. The U.S. now says all of its military personnel will be out of the country by September 11th. It has been 3 months since the military seized power in Myanmar. And today, demonstrators returned to the streets demanding the return of the democratically elected leaders. Protesters aren't giving up in the face of a relentless crackdown, which includes internet blackouts. At least 759 people have died since the February coup. According to an advocacy group, more than 3,400 people have been imprisoned. The United Nations warns that without a collective international response, the general administration of the country could risk coming to a standstill. A marathon a day will keep one BC woman busy all May. Up next, the cause behind the kilometers.
You got a love bite on your neck. Your life's going down the toilet.
Academy Award-winning actress Olympia Dukakis has died. Dukakis won an Oscar for Best Supporting Actress in 1988 for her role in Moonstruck, starring opposite Cher. She captivated audiences with her performances in Steel Magnolias, Tales of the City, and several Canadian productions, including the 2011 film Cloudburst. Olympia Dukakis was 89. Running a marathon may be a once-in-a-lifetime goal, but a BC woman is making it her daily mission this month. Over the next 30 days, Jana Hempler plans to run 1,266 kilometers. Just thinking about it is exhausting. But this runner says she'll get her energy from the cause behind her course. Kylie Stanton explains.
I'm not getting any younger, so it's either now or never.
Most people would choose never, but Jana Hempler is not most people.
I'm going to attempt to run 30 marathons in 30 days, sort of this marathon spree, if you want to call it that.
Hempler has plenty of training under her belt. Back in 2013, she ran the length of Vancouver Island. In 2015, she qualified and conquered the Boston Marathon. And just last year, she committed to running 12 marathons in as many days, raising money along the way.
It just lifted my spirits, to see people donating and supporting, and it was just under 36,000 for the Victoria Hospitals Foundation.
Now with even more miles to cover, she's hoping to raise even more money, $500,000 in total. That once again will go directly to the Victoria Hospitals Foundation, providing priority equipment, research and education needs to the two biggest hospitals on Vancouver Island.
It's a time right now where I know that everyone needs a little bit more inspiration, especially our care teams. When they know someone like Yana is doing something so powerful and so stressful itself, it certainly helps. The care teams see this, and they know people are giving back to the hospitals, and they are so grateful.
This pandemic has been a marathon in itself, and while Hempler knows the next 30 days will be tough, she says they'll pale in comparison to what frontline workers are experiencing. At least her run has a finish line.
Our healthcare heroes, they need more support than ever before, and so this is my way of honoring them.
Kylie Stanton, Global News, Victoria.
Good for her. And that is Global National for this Saturday night. I'm Robin Gill. Tonight, your Canada is Collins Bay in Kingston, Ontario. We would love to see your corner of the country, so please keep sending your photos to viewers@globalnational.com. Thank you for watching, and I'll see you back here tomorrow. Have a great night.